There's many topics that you can discuss with childbirth. GBS, do you want your water broken or not? Do you want pain medications or not? What foods to eat during pregnancy? And it was a conversation and a collaboration with my midwife, Christina, and I throughout the office visits for prenatal appointments and also during the labor and delivery experience. I did work full-time throughout my pregnancy. My midwife kind of encouraged it because birth is seen as and pregnancy is a normal, healthy event, and I was healthy, so I get to keep working. Typically, I feel that midwives have a natural approach to pregnancy and birth, and people think that, you can't be augmented, you can't have medications, you can't have any pain medications. But I really feel in my case and in my circumstance that my midwife, Christina, was doing everything to prepare my daughter and I to have a safe delivery. This is my third child, so I don't feel like I needed to take a childbirth class, but this was my husband's first child. So we went to the class for him, and I actually learned more information from the childbirth class that I didn't know, and I thought I kind of knew a lot about childbirth while I was there, just from listening to the childbirth educator. Christina and I just had such a good working relationship with one another and knew each other, and she knew, my body and I knew my body, that when I said something was happening, she knew to bring me in and to kind of check on things. So we got to the hospital, we went to registration, that was very quick, and we went upstairs to labor and delivery. I got on the scale, checked in with the nurse, and was right in my delivery room. The birthing suite was really nice. They have a nice, comfortable bed. The bathroom was nice and spacious, very clean. My husband stayed with me the entire time throughout my labor and delivery experience. He got to stay in the room at night with us and help to care for our daughter. I was in the tub, I got in the shower, I walked around the halls, and so for a couple hours during the beginning of our labor, we tried to do everything natural we could to increase the contraction frequency and make labor happen on its own. I tried to use the breast pump to simulate contractions, but in the end, they would all start and then they would stop again. Christina broke my water, hoping that that would be the next step to make labor happen on its own. But after a couple hours of my water breaking, my contractions didn't increase in intensity or frequency at all. And so in the end, I ended up having Pitocin, and that's what did the trick for this baby. Although midwives are known for natural care and natural childbirth, I don't want to have Pitocin, I don't want to have my water broke, but I really feel in my case that if that had not happened, I probably would have ended up a C-section. Throughout my pregnancy, I didn't have any problems, but my baby was measuring on the larger side with every ultrasound that I had. So it was reassuring to know that if there was some type of delivery complication, that not only would Christina be able to handle it, but she'd have the backup of a OBGYN that was on call also. I was able to achieve my goal of not having any pain medication or an epidural for pain throughout the labor. She stayed in my room the whole time. Her and my husband took turns rubbing my back and squeezing my hips and reminding me to breathe in and out, and she was just really a great support and was there the whole time. If I wanted an epidural for my birth, I knew that I could have it, and Christina and I could talk about it, and in fact we did talk about it if I would have needed it, what that would have looked like for my birth experience. I know she still would have been able to stay with me and care for me throughout my delivery and entire labor. The nursing staff was great. My daughter and I had the same nurse that was caring for both of us. I got my food on time, I got medications to help heal my bottom on time. They just really cared and were interested in the family dynamics. My older two daughters came in to visit us, and they were very receptive of my daughters. They gave them this cute little "I'm a big sister now" bracelet, and they just genuinely seemed interested and like they cared for our whole family while we were there. So even though the plan didn't go like I had thought, I still was able to participate in the decision-making every step of the way, as far as what position I wanted to be in the bed, what position I wanted to push in, if I wanted to take a walk in the hall or not, and all of those things. While my plan that I had necessarily wasn't able to be done, I felt empowered throughout the entire birth experience still, because I was part of the decision-making process and I had a voice and I was listened to. This was my third time breastfeeding, and I thought that I knew exactly what I was doing. I had breastfed both other children before without an issue, but I was having some latch difficulties this time with my daughter, and pain that I wasn't used to experiencing before. So I knew that we had a lactation consultant available at the office, and I was able to call her and go in for a couple office visits, a couple weight checks, to make sure that my daughter was gaining weight appropriately. I got to meet her. She talked about proper positioning, ways to alleviate pain, some different positions that I could try that I didn't think of trying, because you just forget things as the more children you have and time elapses between babies. Then I went this past week for a weight check and everything was on track. Just felt really well cared for and supported.